Hey everyone, welcome again to another edition of Lupus Talks. Again, I'm the program director Ed Peterson. We have Dr. Kathleen Williams that's going to be sharing some great information in reference to Lupus Talks. You can always check out the website at lupusofnevada.org, as well as the YouTube channel Lupus of Nevada, and as well as the Facebook page Lupus of Nevada. So you have those three sources that we'll be sharing information and giving information to on a regular, consistent basis. And also, if you guys want to check it out, fill out the form on the website. If you have any questions or inquiries in reference to anything that you would like to have seen on the show. So, with that, I'm going to give Dr. Williams the floor. Dr. Williams, take it away.
Thank you. Thank you. Hi, everyone. I hope everyone's doing well. I know there's some people, quite a few people in the hospital suffering from lupus, so my thoughts are with you. This information is just for information purposes, educational awareness, so that's our disclaimer. If you have some issues that you need to talk to your physician, follow the instructions of the physician and take your medications as prescribed, and know when to seek help for drug side effects or a new symptom that might be related to your lupus. So that's what we all should do, and that's what I do. Okay, we're going to be talking about the basics coming from the patient education series from the Lupus Foundation, how lupus may affect my body. That's the resource. When you receive a diagnosis of chronic illness such as lupus, many things about your life will change. When you notice first all the physical changes caused by lupus as common symptoms like extreme fatigue, achy joints, skin rash, hair loss, and or pain all take their toll. You may begin to question your physical ability to keep the job, finish school, or be an effective parent or provide for your family. We want you to remember that one of the most important tools you have is yourself. Remember that is yourself. Think about yourself. Your own awareness is the key to successful managing lupus. You'll want to be aware of the particular symptoms and any changes in your health that could mean new symptoms. When you can, when you can do what you can do is help prevent the flares by knowing what you're eating, by knowing to stay out of that sun. I mean, I do. I'm not telling you what to do, but the things that I have to do is stay out of the sun, knowing what I eat, exercise, drink plenty of fluids. You'll want to be aware of the symptoms, what you can do to help prevent lupus flares, and how to know when a flare is starting, and how to identify and control the sources of tension and stress in your life that often can take a toll on you. As we move on, we go on to what are the physical impacts of lupus? Exercise and movement. Activities are advised for most people with lupus. Walking, swimming, bicycling, low impact aerobics will strengthen your bones and tone your muscles without aggravating inflamed joints. Exercise will also lower your risk for developing osteoporosis. Remember to discuss any exercise with your doctor. Fatigue, often extreme, is the main symptom of lupus for many people, and it can sometimes be debilitating enough to force you to stop your normal daily activities. You will be less likely to push yourself to exhaustion if you accept some adjustments to your usual routine. Don't push yourself, ladies and gentlemen. Do what you can do. Don't try to do everything at once. If you only do two things a day, that's you've accomplished something. Get those stickum notes and put on your mirror and say, this is what I'm going to do today. And that's an achievement there. And put a star by it, make a little star, say you achieved that. It's very important with this lupus that affects our mind as well. Rest is extremely important to people with lupus, especially during periods of increased disease activity, which is flares. It is recommended that you get at least 7 hours of sleep at night. Also, try to allow extra time in your daily schedule for rest. Infections of all kinds occur more often in people with lupus. The most common infections seen with lupus involve the respiratory system, lungs, and heart, the skin, and the urinary tract. You're also at unusual high risk for developing candida, that's yeast infections, and shingles, the same viral infection as chickenpox. I think I had shingles because at one time I couldn't put on any shirts or anything, and I had a big rash across my back, my shoulders, and it was like knives sticking out my back. It was just knives sticking. So check on that. No, I didn't get a shot, ladies and gentlemen. I just managed to deal with it. Fever can be a warning sign of a flare or an infection. If you have fewer of 100 degrees Fahrenheit or higher, you should see your doctor right away. Sensitivity to ultraviolet UV light affects 2/3 of people with lupus. Ultraviolet light is from sunlight, artificial inside light, fluorescent light. My eyes are very sensitive when I come into a building and there's fluorescent light. Now, I know when you go in your doctor's offices, they have fluorescent light. If that affects you, you need to tell your doctor that can they turn off one of those lights because it's affecting you and bringing on a flare. Whether or not you are UV sensitive, you should limit your exposure to UV rays, especially outdoors, as excessive exposure to the sun can cause lupus flares. Other precautions include use plenty of sunscreen, especially on your neck, temples, and ears. Make sure your sunscreen has a sun protection factor of at least 30 that blocks both UVA and UVB rays. Wear broad brim hats, long sleeve shirts, and long pants, preferably made of sun protective fabric. And where you can get those at, I went to an Iranian store and I got the fabric because over there the sun beams down 120 degrees and they have that protective fiber, and it worked well for me in California. Plan your outdoor activities for early in the morning, late in the afternoon, or in the evening. Place light shields over fluorescent bulbs in your office. That's so important. You also want to keep calm, keep your mind straight. Know this too shall pass. The lupus is there. You have people that there that are helping you and that care for you as well. Vaccines against a variety of diseases usually do not cause problems for people with lupus. However, because your immune system may be weakened, you should always talk with your doctor before receiving a vaccine. Allergies and allergy treatment generally do not cause problems for people with lupus. However, if you receive allergy, if you receive allergy shots, it is possible that a lupus flare can be triggered. Therefore, it is best to discuss the allergic reaction or the treatment with both your doctor and your allergist. Pain. Pain is common for most people with lupus, especially joint or muscle pain or headaches. However, the types of pain associated with lupus usually go away when the inflammation, disease, activity are brought under control. Chronic and often severe muscle pain is the main symptoms of a disease called fibromyalgia. Let me repeat that again, ladies and gentlemen. Chronic and often severe muscle pain is the main symptoms of a disease called fibromyalgia that affects about 30% of people with lupus. While pain medications are helpful and in many instances necessary, other approaches to pain relief are available. Heat or cold packs, behavior techniques such as progressive relaxation, meditation, or low impact yoga, healing practices such as acupuncture. I had that and it healed my whole body. I'm telling you, I felt I was so comfortable, and the pains that I had, it just after a while it just took it away. So I'm an acupuncture fan. Acupuncture, biofeedback, or chiropractic adjustments. Depression often accompanies lupus. There are several reasons for this. Depression can be caused by drugs prescribed to control lupus, for example, high doses of cortisones, nervous system, um, and the physical effects of lupus on your body, emotional and psychological stress related to coping with chronic illness. This is me here. Memory loss and lupus fog are familiar to many people with lupus. These feelings of confusion and loss of memory may come and go or be continuous and can make it difficult for you to manage your usual activities. I suggest there write notes to yourself. If you're thinking a thought, write it down. Write it down. If you're thinking this is what I'm going to do tomorrow, write it down. A psychologist or speech language pathologist can help you learn to manage these symptoms. It's so important to manage those symptoms. Um, Diet and nutrition. Guidelines for people with lupus are not different than for anyone else. Fruits, vegetables, Whole grains and moderate amounts of meats, poultry, and oily fish such as salmon, sardines, trout, swordfish, as fish oil has been found to help reduce inflammation. However, you may have to add or remove certain items from your diet because of medications you're taking or because of the damage that the lupus has done to certain parts of your body. Omega-3 fatty acids appear to decrease the risk of coronary artery disease. Including these fatty acids in your diet is of special importance if you are a woman with lupus, as you are at 5 to 10-fold higher risk of a heart attack disease than the general public. Before you add herbs, dietary supplements, or vitamins to your diet, discuss with your doctor as these products may interact with medications used to treat lupus. Rich food in calcium, spinach, broccoli, collard greens, dairy products, calcium supplements with vitamin D will help protect you from osteoporosis, a bone weakening disease that is caused or worsening the body as well. Pay attention when receiving new information. Repeat it, write it down, verify your details. Again, pay attention when you receive new information. Repeat it or write it down. The details are important. Focus on one task at a time. Focus on one task at a time. Take good care of your body because it's the only body you have here on earth. Exercise, eat well, and get enough sleep. Learn memory techniques. Associate a person's name with an image or repeat their name several times in conversation. Try to stay organized. Use a year-long calendar to keep appointments, plans, contact information, and reminders in one place. Cigarette smoking has been linked to development of many autoimmune diseases, lupus included. Let me read that again because some of the folks smoke I've seen that have lupus. Cigarette smoking has been linked to the development of many autoimmune diseases, lupus included. Smoking can cause flares of cutaneous skin lupus, so try to stop smoking if you can. That's so important. As we go on to lupus and the gastrointestinal system, that's the stomach. We're going to go talk about the stomach now. Um, the esophagus is a muscle that joins your throat to your stomach. When lupus causes inflammation to the esophagus, stomach acid can move back up into your esophagus. Almost everyone experiences this backward flow of acid called reflux. I have that from time to time as either gas or a burning sensation of heartburn. You know, you swallow something or you're eating, say you're eating a hot dog and you're eating it fast. It lodges right in the middle of your esophagus. However, reflux can keep occurring, and it's known as the esophageal reflux disease. It's known as GERD, G-E-R-D, GERD, G-E-R-D. That's what it's known as. So if you want to look it up, that's what the word is, G-E-R-D. The most common causes of GERD are hiatal hernia caused by weak muscle between your esophagus and your stomach. Let me go over that again. That hernia, it is caused by the muscle between your esophagus and your stomach, or by weak muscle contractions in your esophagus. In addition to reflux problems, may also cause you to have difficulty swallowing, a condition called dysphagia. I may be pronouncing that right, but that's how I see it. They had to go into my throat and widen my throat because I couldn't swallow things and get them down my throat. So they went, it's a normal procedure. They put me to sleep, put a tool down and widen my, my esophagus. Digestive difficulties. Difficulties are common in lupus. The symptoms you may experience include nausea, vomiting, diarrhea, or constipation. Often these symptoms are caused by drugs you take for lupus, such as the anti-inflammatory drugs, the NSAIDs, and the cortisone. Sometimes, though, these symptoms occur because your muscles are not properly moving waste through your intestines. The group of symptoms is known as irritable bowel syndrome. I was going to mention that IBS because that's what happens to me, IBS. And some of us can't stop by going to the bathroom. When I go out with family or if I eat something, I have to sit right next. I have to know where that bathroom is, so in my area, so I can run right to it. Um, it may cause irregularities in your nervous system. I know I cannot eat the French toast with syrup on it because that's just like a laxative to me, and it was like that the other day. So now I know I can't do that. Uh, ulcerative, let me see which causes ulcers in the lining of the rectum and the okay, Crohn's disease. That's what this is. I see what it was. Crohn's disease, which causes inflammation of the digestive system, are two forms of inflammatory bowel disease that affect the colon. Bloody diarrhea, abdominal pain are common symptoms in both, but there are different. They will help you. They will help your doctor distinguish between two. People with lupus sometimes will develop ulcerative colitis, and that's what I have. But only rarely will a person have both lupus and Crohn's disease. Okay, we're going to the next one, which I think is so important. Uh, Liver complications. Your liver is the largest organ inside your body. It is also one of the most important. The liver has many jobs, including changing food into energy and cleaning alcohol and poisons from the blood. Your liver also makes bile, a yellowish green liquid that helps your digestive tract. When lupus causes inflammation in the liver, a condition called vasculitis can occur. This affects the blood vessels that supply the liver and can cause blood clots in those vessels. The liver may also become enlarged due to vasicities or congestive heart failure. People with lupus may also develop jaundice, a liver condition that gives a yellowish color to the skin. Jaundice in lupus also can be a sign of anemia or uh, pericarditis. If your liver enzymes levels are increased, this may be due to the NSAIDs, or may be a sign of lupus activity. Be aware of that. All this information is for you, and you're going to get it on the website. You can play this back, and like I said earlier, you can get it with patient education series under the Lupus Foundation, Living with Lupus. Autoimmune hepatitis is a disease which the immune system attacks the liver, causing the liver to become inflamed. Autoimmune hepatitis is classified as either type 1 or 2. Type 1 is the most common from North America. It occurs at any age and is more common among women than men. About half of those with type 1 have other autoimmune disorders such as type 1 diabetes. And they always ask you guys, do you have diabetes? I have more doctors asking me that um, when I go in to see my doctor. They're always saying, you have diabetes. Well, you should know because you ask me that all the time. But that's exactly what they do. Do you have diabetes? Do you have diabetes? So I think they got used to me now. There's some others that are important that I might have skipped over. Uh, about half of those with type 1 and other autoimmune disorders such as type 1, diabetes, proliferated, systematic, lupus, Graves' disease, Sjogren's syndrome, autoimmune anemia, or ulcerative colitis. Type 2 autoimmune hepatitis is less common, typically uh, affecting girls ages 2 to 14, although adults can be affected. Fatigue is probably the most common symptom of autoimmune hepatitis. Other symptoms include an enlarged liver, jaundice, itching, skin rashes. I have discoid lupus, which is contagious lupus. When I get out in the sun, my arms seems to just blister up and they start itching. Um, Joint pain, abdominal discomfort. So let's go over that again. Other symptoms include enlarged liver, jaundice, itching, and skin rashes, joint pain, abdominal discomfort, abnormal blood vessels on the skin, spider, amygos, nausea and vomiting, loss of appetite, dark urine, and pale or gray colored stools. Watch for that. Because several viral hepatitis or hepatitis can be a drug. For example, certain antibiotics have the same symptoms as autoimmune hepatitis. Tests may be needed for an exact diagnosis. Your doctor also should review the rule out drugs you are taking before diagnosing autoimmune hepatitis. Both types of autoimmune hepatitis are treated with daily doses of cortisone, such as prednisone, or Imuran is also used. Peptic ulcers, that's what I grew up with, peptic ulcers. If you take NSAIDs as lupus treatment, you are increased risk of damage to your stomach, which is true. We damage our stomach with with the medications we take. This tissue damage could cause bleeding, ulcers to develop either in your stomach lining or in your stool, where your stomach bile duct and pancreatic duct meet your small intestine. Ulcers also can be caused by the bacterium, which may be more common in people with lupus due to their generally higher risk for infection. Medications that help prevent ulcers from developing include Provocet um, and other medications. This one is called PRILOSEC, Prilosec, and CYTOTEC, Cytotec, and medications that help to relieve the upset stomach associated with the NSAID use Zantac, Pepcid, and Tagamet. That's what they use, and that's so important. So we just reviewed the lupus and the gastro system. Now, the next one we're going on to, what I need to know about lupus treatment. For most people with lupus, proper treatment can minimize symptoms, reducing inflammation and pain, and stop the development of serious organ damage. Once you have been diagnosed with lupus, your doctor will develop a treatment plan based on your age. Lupus symptoms generally health and lifestyle. However, if it can take months, sometimes years, before your healthcare team can find what right combination of medication to keep your lupus symptoms under control. The goals of any treatment plan are to reduce inflammation caused by lupus, suppress an overactive immune system, prevent flares and treat them when they occur, control symptoms like joint pain and fatigue, minimize damage to organs. Now, they say it takes 7 to 10 years to figure out if you have lupus. That's the years they throw out there. I don't see it. I saw it in writing, so it took a long time for them to diagnose me in Northern California that I had lupus when I went blind. And that's when they found out after the other eye went down that this young lady has lupus. And I couldn't see for 3 months and wasn't supposed to see wasn't supposed to see, period. I'm supposed to be blind now, but through the grace of God, He's given me my sight. What are the medications used to treat lupus symptoms? Many classes of drugs exist for the treatment of lupus. Of all these drugs, only very few approved specifically for lupus by the Food and Drug Administration, the FDA. So we're looking at prednisone, we're looking at Imuran, methotrexate, hydrocortisone. Am I correct? Yeah, because I take that. Anti-malaria, hydrocortisone, which is Plaquenil, aspirin, and many medications are used to treat the symptoms for lupus. Now, when you look at the anti-inflammatory drugs help to relieve many of the symptoms of lupus by reducing inflammation of pain. The aspirin, you want to ask about the aspirin? The aspirin is inexpensive and available over the counter. I take baby aspirin. They won't give me the other aspirin because of my kidneys. My kidneys are good, but they still don't want anything to happen. But that depends on your doctor. Aspirin is inexpensive and available over the counter. It reduces pain and inflammation and acts as it should to help prevent blood clots that can be caused by lupus. However, aspirin can cause stomach irritation. Um, this one is non-steroidal anti-inflammation drugs, which is NSAIDs that we talked about suppresses inflammation and are especially used for joint pain, stiffness. However, the NSAIDs can cause stomach irritation. You should always be cautious when taking the type of NSAID. In excessive amounts can reduce blood flow to your kidneys, which may interfere with their ability to remove waste from your body. That's why I said it's very important, ladies and gentlemen, that you drink a lot of water. It's very important. Take as much water as you can. I do. Again, that's not telling you what to do. I'm telling you what I do. I take a lot of water, and I try to stay away from the beverages. Sometimes it's hard, but I know that's not going to help me. So the water is, especially the spring water, is good for me. Um, we are going to look at the anti-malaria drugs are used in combination with steroids and other drugs, in part to reduce the dose required of other drugs. Anti-malarials also protect against the damaging effects of ultraviolet light and improve skin lesions. Unlike rapid response seen with steroids, anti-malarials may take months to be in effect. Hydrochloroquine, which is Plaquenil, and chloroquine, and the two types of anti-malaria that's used. Those are the two types, Plaquenil and the other one, hydrochloroquine, are the two. Side effects from the anti-malarials are rare and usually mild and include upset stomach and changes in skin color. In high doses, certain anti-malaria drugs may damage the retina of the eye, causing vision problems. So you should see your optometrist eye doctor regularly. And I see mine twice a year because that's what they're looking for. I take two of the Plaquenil. I was taking one until my doctor said, you have to take two. So that's where we are with that, but it's just, it's something else. I cannot take methotrexate because it almost killed me with the Plaquenil. Methotrexate was also developed to fight cancer. It improves joint pain and stiffness. However, it can cause sun sensitivity, liver damage, including cirrhosis and lung infections. If you're taking this drug, you should not drink alcohol, especially if you have a history of kidney disease. If you're taking high dosage methotrexate, you should not be using the NSAIDs. Caution, it is advised when you take the aspirin, nausea, mouth sores, and headaches are the most common side effects of the methotrexate. Now, let me tell you, ladies and gentlemen, my lupus came on because I was drug induced. I know that's a shock to many. It was a shock to me when my doctor came back and said, we don't know who did it, but you've seen many doctors and you have been drug induced. And usually drug induced with the men, it goes away. With me, it stayed with me. So I had heartache from that. I was very angry about that because that was me. You gave me something I didn't want. And it took me some time to try to understand it. And I still today don't really understand what happened. I was trying to find out who, what. There's so many physicians that worked on me that no one seems to know anything about anything. So it's just horrible. But the best approach to taking medications used to treat lupus range in strength from mild to extreme strong, and often several drugs are used in a combination to control the disease. However, all drugs have side effects that need to be monitored. Your physician needs to know of any and all side effects that occur as changes in the dosage or medication may be required. That is very important, ladies and gentlemen. Your physician needs to know all about the medications you're taking. If you're not feeling good, jot it down. This medication made me feel this way. This medication made me feel that way. And he will be able to adjust that medication, or preferably he may be able to take you off that medication. I see we're getting ready to wind down. It's 2:29. I'm going to ask Ed to come on. I'd like to thank all of you for joining in with me to go through the basics of what we just did with what I need to know about lupus and the gastro system with lupus and how lupus may affect my body. I appreciate everyone for being on here. I ask God to bless them, and you're going to see me next week as well, and you'll see Dolores on the show as well. Ed, I'm gonna wait till he comes on. Edward, hello. Well, I guess he wants me to keep on going. You have to have strength and courage, you guys. And that's what I have, strength and courage every day. It bothers me when I look at all the medications I take. And there's just so many medications. I've got, you can count 28 of them, 27 of them. I think it's 27, 20. It's just so many of them. And it hurts my heart because, it's difficult. Every morning I have to take that. At nighttime, I take 4 of them. um, People don't know what we go through when we have to take all this medication. But yes, I'm not in the hospital. Yes, I'm doing fine. Yes, the medications are working. And I shouldn't be complaining about what's happened in my life. I should thank God that I am alive and I'm here to help you. And as much as I am, Lupus of Nevada has been in existence for over 21 years, and we're going to continue to give information out and help as many people as we can. We urge everyone to come online, join us in talk show. If you have any ideas, if you have any complaints, if you have whatever you have, bring it to the table so we all can share into it. And don't forget to push view, like, subscribe. Thank you for joining us. Edward, Ed,
I'm here.
okay,
All righty.
that's it.
All right. So, well, thank you very much for that, Dr. Williams. That was great information you were sharing, and we'll be back again next week to talk more further about it. And as we continue to build and grow and showcase that, again, you can always visit the website at lupusofnevada.org. Support the cause. And then as well, she's an author of a book, Loving God While Living with Lupus. And Chris and Christina have lupus as well. It's another book of hers. And again, this is just to support the cause of what we're doing, share information on a regular, consistent basis. So with that, until next week, you guys keep the faith and keep building your dream. Bye for now.
Thank you.
Bye-bye.
Bye-bye.